Hi everybody, it's me, Robin Krasny, and I'm with my friend Shannon Marsh, who I've known since the beginning of time. Actually, since 8th grade, right? She moved into my street in 8th grade, and we've been best friends ever since. So in her career, her long career, she has been studying. Please give me your background. Give everybody your background so that we can. Hi, Dave.
I have a master's in public health in epidemiology, and I have worked for 27 years as a public health specialist, mostly doing disease control of epidemics and pandemics, such as COVID. And so I've had a lot of experience around the world because for over 10 of those years, I have worked in the U.S. Foreign Service as a health officer at national levels and local levels.
So you spent a lot of years in Africa and different countries around the world working in public health and supply chains and all sorts of things to get medicine to people. And
That's right.
Yeah. So as you guys know, if you've watched my page, my music partner of 27 years just died a horrible death due to COVID-19, which many of us feel, as I do, was a totally unnecessary and preventable because, why, Shannon?
Because we have vaccines. Because it is completely preventable if you can follow the necessary preventive measures.
Now, I have a question for you, Shannon, because I know people that have been vaccinated that are getting sick. Why is it still, people go, well, I could get sick anyway if I get the vaccine. Why should we get the vaccine still?
Well, so first of all, you have to realize that there is no vaccine in the world that's 100% effective at blocking whatever disease.
Okay.
But the second thing is that the vaccines that we have against COVID right now they protect against three different things. One is infection, two is against hospitalization or severe illness, and the third is death.
Which Eddy just experienced, and everybody in his life is experiencing because of him.
Yes. So the vaccines that we have are incredibly effective at preventing against severe illness and death. We have watched those rates drop significantly in the vaccinated populations, but they're not quite as effective at preventing the infection in the first place. They're still effective, but not as effective. And that is why vaccinated people still need to wear their masks in public.
Okay, so the masks, let me ask you about the masks. I've seen all kinds of masks out there. I mean, there's all kinds of crazy masks that people are wearing, and like a handkerchief over their face, and what is a good mask to wear to be the most protected against this virus? Because, I hate wearing masks. I'm sorry, everybody hates wearing masks. I don't think there's anybody here that likes to put something over their face, and I teach breathing. So it's hard for me to wear a mask, but you know what? You ain't seeing me go outside without a mask. Now we're sitting here together because we're both vaccinated, super, super careful because I'm trying to protect my mom.
And I'm trying to protect my unvaccinated 9-year-old daughter who's not eligible yet for a vaccination.
So thank you, Robin Lippman, by the way, for so many things, but for being on here as well. So the kind of mask that would do the most and bestest protection. Now, when I go out, I'm wearing 2 masks and a shield because I'm looking like a stupid person and nobody knows who I am when I'm in the grocery store. So what kind of mask is the best?
So, there are different levels of protection that masks can afford you. So the number one type of mask is an N95. But the second best, a very close second, is a KN95,
okay,
which is sold pretty widely now.
There was a shortage of them at first of the pandemic, and you were supposed to just wear whatever and put your underwear over your head. But now we've got masks, right?
Right.
Okay.
There's no reason why people can't buy the good masks now. They're plentiful on Amazon and in other places. So that's the second level is KN95. The third level would be a surgical mask, and
is that the ones that are like blue on one side and white on the other? Okay.
Yeah.
Okay.
And then the fourth level would be a multi-layered cotton, 100% cotton mask.
Okay.
And then the last is everything else. Okay.
Like
So let me say some of the things you shouldn't have. Like an all nylon mask doesn't work
Oh, I
because
bought
the
one of those
nylon
at the
is too
beginning.
slippery, and the virus particles can slip through.
Oh, thank you, Joe. Joe said, great question. He was asking about masks last night.
Yeah.
So this is important, everybody. Because guess what? Eddy wouldn't wear a mask.
Yeah. Now another one that I see around here a ton.
I'm sorry. Go ahead.
Yeah.
All right.
Is gaiters, neck gaiters. People love to pull them up. They're easy to wear and get out of your way, and they're always there around your neck, right? So they pull them up and they
Right.
think they're doing something. Honestly, neck gaiters, you might as well not have anything on. They do nothing.
Really?
Yes.
Well, that
So,
sucks. You just wasted $20, by the way.
Yeah, yeah. The same thing is if you have your bandana tied around your face.
Oh, that was
Yeah.
my boyfriend's trick. That was Whitney's trick.
Yeah.
Whitney, I hope you're listening.
I mean, the only way a bandana would protect is if it were 100% cotton and 100% cotton and you had it sealed, right? But most people don't. They just tie it like this and then the bottom is flapping around, right? So the important thing with any mask is that you make sure it fits your face right and it seals around it. And of
Okay.
course, wearing it
doesn't
like
work.
this or like this
Yeah,
or like
yeah.
this doesn't work at all.
Oh, that's so many people in our Brevard County. Thank you for the mask thing. Thank you, everybody. You can just throw some questions up there if you have any. So many people in our county in Florida are just running around without masks. I've been vaccinated, I'm fine. Or I don't believe in vaccines because it's like a hoax or Republican, I don't know, Democratic hoax, whatever the politics are. I don't care. People are dying. When Eddy was on his deathbed, nobody asked him, hey, are you a Republican? Who you voted for? I know who he voted for, unfortunately. But he believed that line of BS 1,000%. And he refused to wear a mask and he refused to get vaccinated. And he's dead. And it was horrible.
Yeah.
Don't be Eddy. This is why we're doing this video series. Don't be Eddy. Don't die because of your beliefs or your lack of understanding. This is why Shannon's here. I want to ask you, Shannon, about getting tested. When do you get tested? Like if you were out at a party and you get a phone call, so and so was positive, and you were hanging out with them, smoking a joint or drinking a beer or whatever, or you were in their space inside. When should you go get tested to find out if you actually are positive?
Right.
And what kind of test should you get? Sorry, I
Right.
got so many questions. Everybody's got questions, and if I've got them, I know other people have them.
I know. There's
Thanks, Dave.
we like to say in the public health world, there's a pandemic out there, but there's also an infodemic, just an onslaught of disinformation and misinformation. So I appreciate you
Don't get me
doing
started.
this.
I'm going to do some on that later.
I appreciate you doing this to give some good, clear information to people. But as far as testing goes, so if you think you were exposed or if you know you were in the presence of somebody who turned out to be positive on their test, you need to wait 3 to 5 days before you get tested. And the reason for this is so that your body can build up enough virus to be detected by the test. So once you wait 3 to 5, so 3 days, 4 days better, 5 days great.
Then you'll know for
Yeah.
sure. The test
Yes.
will know.
The test will know 100%. Then you go get tested. There are a lot of places now that will do the tests and give you results back within 24 or 48 hours max. Sometimes they can turn them around even faster. But what you want is a PCR test. The rapid tests and the home-based tests are not nearly as good. The rapid tests give a lot of false negatives.
Oh, so you could still be positive, and you're like, oh, I'm negative. Look, my rapid test says so.
Exactly.
And you're not.
Exactly. And there are even now home-based PCR tests where people can buy the kit, they can swab themselves, and then send it into a lab that does the PCR analysis. The problem is that a lot of that sounds great in theory and in the lab. It works great when they're doing controlled experiments. But in practice, in real life practice, a lot of people don't swab themselves correctly, and so they don't get the necessary.
Sorry, thank you. We're going to
sample.
stop just, okay, so let me finish that, Robin. Monoclonal antibody infusion prescription, necessary or not, time frame receiving at 7 to 10 days, conflicted answers. Okay, we're going to address that in a minute. So more about the test, Shannon. Why I get a text from somebody that says, oh, the PCR tests are good. They're no good because the FDA is not, they're expired in January. And did you see that text I sent you?
Yeah.
Well, explain that, because people are under the impression that PCR tests are no good because there's an expiration date on it and they're just going to scrap them. Like, I didn't understand where they're coming from.
So I think everybody has to remember that this, in terms of an epidemic, a contagious epidemic that has spread this wide around the world,
This fast,
we're still in the beginning stages of it, and we're still understanding everything, and we're still learning. So whatever scientists do, they go with the best information they have at hand at that time. And they're looking for evidence-based information. Okay, a lot of people have opinions. I've even seen doctors giving opinions that are not right. But what you want is to find evidence-based information and base your decisions on that. But
go ahead. This is how we work as friends for this many years. I'm smart. I think I am sometimes, but I went to college. I have a degree in psychology. I have extended education. And even I don't know where to find this good information. And some of it's hard to read. I want to download the skinny from you, okay? So, gotta run. Wash your hands, don't touch your eyes. Good job, Joe.
But even better, wear your mask and get vaccinated.
There you have it. So, you were saying about information.
Yes.
I mean...
So there's a lot of information out there.
But the PCR test, why did they say there's an expiration?
So getting back to that, the reason why I was saying about information is that a lot of people think that because these tests or treatments or vaccines only have emergency use authorization, an EUA, that it's not as valid as if it had full FDA approval. And that's not correct.
Why?
So the reason they have emergency use authorization is because we have had to respond quickly because of the fast contagion that's happening.
It's a
right?
wildfire. Yeah.
So, regardless, to even get an EUA, it has to go through some level of testing. The vaccines went through extensive testing.
Okay.
Extensive. And at this point, we have hundreds and hundreds of millions of people around the world who have been vaccinated without any side effects. Okay.
Well, I only get the videos from people that said they had a side effect from the vaccine, or somebody they knew that died.
Right. But they might have died from COVID too. Believe me, dying of COVID is much worse than having a sore arm or having a fever for a day.
Yeah.
Okay. So anyway, the tests have an emergency use authorization too. The EUAs are a temporary authorization. They're meant to be temporary until they can get full FDA approval. That process, beyond the testing that they go through, the process for full FDA approval is really just the bureaucratic administration that goes on top.
So that's why there's an
clinical
expiration
testing.
date on the PCR
Yes,
test?
so the EUA has an expiration date because they hope that the full authorization can happen, or else they will look at it again and
continue
the authorization.
So that's bullshit. We just debunked that. Okay, thanks, Shannon. All right, so moving forward, we have something about the monoclonal antibodies. Now, there's new information coming out all the time. And are you up to speed on that, or do you want to talk about that next video?
It depends on the question. I'm still reading a lot on it, so I would rather defer it if we can, but I will address
We'll hit you up on that next time, Robin, about the monoclonal antibodies. I do know, from what I do know, if you're positive and if you are within 10 days of symptoms, you can go get these. They're not even infusions anymore. They're called subcutaneous, so where it doesn't take as long. It's not an infusion anymore. They can do it subcutaneously. And who knows? Guess what? What you told me, those are just under emergency use authorization too.
Yes.
So
And they're still investigational.
Right. Right.
Yeah. So, and I think the infusions take about 20 minutes. I think doing it through injection, from what I know, and I will check this out, is a second choice
Okay.
to having it infused.
All right. Another thing I wanted to run this by, because I got a zillion texts from people. Just give Eddy ivermectin. Now Eddy was in the hospital. Nobody was giving him anything. His blood oxygen dropped down to like 90, and we barely got him to the hospital. He walked in of his own accord, and then quickly deteriorated. So quickly. So I couldn't give him anything. I couldn't even give him a hug. I couldn't even hold his hand when he was crossing over. All I could do was look at his dying body on video, on a FaceTime video. It's horrible. You don't want to go through this. Don't be Eddy. So this is what I'm curious about. This ivermectin. Yes, it's been used as an anti-parasitical around the world. There's been a lot of people anecdotally that have said, oh, my family's family took it and they're fine now. What would you say, and why wouldn't we do this, the ivermectin?
So again, there's a lot of disinformation out there that's confusing people. And there's a lot of information out there that looks like a doctor saying something or a study saying something, and in fact it's not valid information. So the truth about ivermectin is that it is being investigated now. There is so far many research studies have been done that have not been conclusive. It does not show any conclusive evidence that ivermectin helps. Now that doesn't mean that anecdotally you might hear of people having success with it. But the thing is, with any one person, if you're just having a sample size of 1 or 2 or 3, it's not a valid sample size. You can't make extrapolations over a population for 1 or 2 or 3 people. So you don't know, has that ivermectin helped them because of their unique body situation, whatever their body is, or is it just a coincidence? Maybe they would have healed anyway without the ivermectin.
I don't know.
So,
I mean, I might just have some on hand just in case, but I'm just saying, could it cause negative side effects?
Yes.
Oh.
So we do have studies that have shown that people who have taken it have actually done harm to themselves by taking it. So that is the reason why, until you get evidence that it actually does help, that you shouldn't take it.
But if you got positive, what's the best thing that you can do?
If you're positive...
Because Eddy fell into a hole.
Yes.
I mean, and here's the thing I told him, everybody. When he got... First of all, I begged him to get the vaccine. I yelled at him. I screamed at him. I cried to him. I said, why don't you get the vaccine? And his response to me was, what if I get the vaccine and die? How would you feel then? And I said, what would happen if you got COVID and died with a tube shoved down your throat? How would you feel then? And that's where we ended our conversation. And he didn't get it, and he didn't wear a mask, and he ended up getting COVID and dying just horribly that way. So I'm saying, I said to him when I was talking on the phone with him while he was sick, and by the way, this presented a lot as digestive issues, like a stomach flu. And my boyfriend's daughter is a nurse in Orlando, and she said that the hospital has given them all a mandate that said if somebody comes in with stomach and digestive issues, they're automatically presumed to be COVID positive.
Yeah, with the Delta variant, we're seeing a lot of patients present with
diarrhea, GI
yeah.
symptoms, all that kind of stuff.
Mm-hmm.
So I talked to Eddy, and I told him, when you start to feel bad, you're not going to want to get up and go do something proactive for yourself. I mean, when you're tired and you don't have enough oxygen getting to your brain, last thing you're going to do is want to go get up and get to the hospital somehow, or even get out of your own bed and the comfort of your own bed. And I know for a fact that Eddy would have died on Sunday night if he hadn't tried to get medical treatment at the hospital by everybody's insistence. I mean, so... when you start to feel bad, Shannon, what can you do to mitigate symptoms if you're vaccinated and you get COVID still?
So part of that depends on what symptoms you have. But 2 very important things. If you're sick and you're at home, you want to make sure you have a good thermometer and a good pulse oximeter. And you want to be monitoring the entire time your oxygen saturation level and your temperature. So your oxygen saturation level, a normal person is at like 97 and above.
Okay.
That's your normal saturation level. If you drop down to 93 or below, that's the danger zone. People start dying when they hit 92. So you don't want to really get down that low without getting serious help. So if you start to approach 93, 94, at that point you've got to get yourself immediately to a hospital, to an emergency room. In the meantime, before that, what you want to be doing is keeping your primary care physician apprised of your current symptoms, your current condition. You want to monitor your temperature, tell them, how long you've had the fever, how frequently it comes back, what level the fever's at. Is it 103, 104? So you really want to keep them apprised of all the symptoms, GI, whatever. If you're starting to have trouble breathing, that's a bad sign. If you're having trouble thinking, that's a bad sign.
Yeah. We were keeping apprised of all that with Eddy. I was, anyway, and a few of my friends and everything, but he walked in on his own and he was still he crashed so fast.
Because he waited too long. He waited until the damage to his lungs was already done. This disease, when the virus hits you, it will inflame your systems, your respiratory system. It can get into other systems like your brain, other organs. So the worst thing here is that the inflammation causes, one, trouble breathing if it's in your lungs, but also damage because it gets so inflamed. And unfortunately, I think that is what happened to Eddy, was that by the time he walked in, he was probably already damaged.
Yeah.
And though they tried their best,
either,
though they tried their best, it was too late to help him.
And God, those nurses, the ICU nurses and doctors, thank you for everything you did to try and save Eddy. And you did everything, I know, and they were so kind. And they're overwhelmed right now. They're just absolutely at overwhelmed capacity, both here and here and in the hospital system. So if you can just go get a vaccine and just sit tight and let your antibodies build. And here's when I got my vaccine, I had some symptoms, and all I did, I prepared before I went for my vaccine. I made this huge, amazing pot of chicken soup with garlic and ginger. Mind you, I'm a holistic person. I'm not a vaccine freak in the first place. I know we've always had this discussion. I've always been against vaccines, and she's always been pro because she works in public health all over the world, and she's seen what it's done to help save people all over the world. But I don't think, kids need an HPV vaccine when they're 3 years old. I'm just like, no. So I believe in holistic stuff and healing yourself with natural things as much as you can, but that's just to keep your immune system as strong as you can. This virus is not, it's like the bubonic plague. It's like smallpox or polio. We don't have those around anymore. Why?
Vaccines. Yeah, the only way we're going to get out of this is through vaccines and masking. And, at this point it's spread far, and the more we let it spread, with every person that we let it spread to, their body is an opportunity for it to mutate. So the more it spreads, the more mutations we're going to get. Not all mutations are dangerous ones. A lot of them don't survive. The ones that survive are the ones that figure out how to get around the current barriers and still infect people. So really, we need to get as many people vaccinated as possible so that the virus does not have as many bodies to attack.
Yeah.
And that's what's going to stop this. And in the meantime, until enough people are vaccinated, we have got to wear our masks. It's a barrier to transmission.
Yeah, and receiving, I would suppose.
Yeah, if you look at the studies, it's actually more effective if the people who are infected wear it than if the people who are possibly being exposed wear it. Obviously, most effective if both wear it, right? But if you have to take it off of one, keep it on the one who's infected.
Well, duh. They shouldn't even be outside. They should be in quarantine, but they don't know.
But a lot of people don't know because it's asymptomatic many times. And we have seen an enormous number of asymptomatic cases, even in vaccinated people now.
Well, Shannon, this has been enlightening, I hope, for you guys, definitely for me. And Robin Littman on the other end, she was a nurse. She just put some information up there about things to do, and she also said that the respiratory therapists are overwhelmed. No doubt about it. I want to thank you, Shannon, for being here. We're going to come back and do some more. Private message me your questions, and we'll see if we can't get you some learned info to yourself so that we can stop the disinformation, which is a virus in and of itself.
Yes.
We don't even think about updating our just let me go on a rant here for a second. We don't even think about updating our computer virus software. We don't even think about it. We just like, oh yeah, there's a new virus out there and it's getting into these systems and it's corrupting those systems. So is this disinformation. So the vaccines are our antivirus software. They're our new plug-in to help with the virus, to help mitigate it, slow it down. And it's going to find, it's like a worm. It gets in there, finds some more ways in. And we need to just keep upgrading our viral software. In the meantime, the disinformation is a virus. It's gotten into people's brains, into the consciousness of mankind, and it is rendering unable people's systems of reasoning, of thinking clearly and looking at the facts, the scientific data. In this Brevard County alone, we are like a 24% positivity rate where I live.
And we're only about a 51% fully vaccinated rate, which is not high at all.
And I just get so upset when I think about this. Our ICUs are full, and like a few days ago, there were like 400 people in the ICU in our hospitals with COVID. 4 of them were vaccinated. 396 were unvaxxed. What does that tell you? The numbers do not lie. Get vaccinated. Wear a mask.
And check your sources.
I've sent you a bunch of stuff, and you're like, where did that come from?
Yeah, I know it's really confusing for people to understand where to get good information. And unfortunately, there's been a great disservice done to some of the institutions that do provide excellent information. But, as an epidemiologist, one of my tasks when looking at diseases is to find out where it's from and how it's transmitted. And we can do the same thing with bad information. We can trace back and figure out where it's from and then how it's transmitted. And for example, there was a notion that went around that was spread first by an article in the Federalist that misinterpreted a valid research study. And they said something like 85%, or masks are 85% ineffective, non-effective is what essentially they were saying. And they said that the study proved it. And they had completely misinterpreted the study.
So then they got out there.
So they put it out there, then Tucker Carlson on Fox News picked it up, and now he spread it out to like 40 million viewers or whatever, and then the president at the time, who was President Trump, picked that up, and he further was another megaphone to spread that or disinformation even further. So you can see how sometimes
people's minds,
and that is what's causing a lot of people to resist masks. They think they're not effective
because they heard a bad piece of information, a bad virus of bad misinformation got into their hard drive and made them unable to see anything past that.
That's right.
It is it's same.
So, yeah.
It just
but if you were looking for how to figure out if that's right or wrong,
right,
you would go back. So, well, where did we find it? Where did Tucker Carlson get it? Oh, he got it from the Federalist. Where did the Federalist get it? What study are they quoting? Look at the study. Read the study yourself, the source study, and see if that's what it actually says. Okay?
We just want to bring some clarity and hopefully ease suffering here, because God knows that's the only reason I'm getting here, in my grief and my pain, and you can probably see it, and a bit of my anger. and bring some sense of awakening, understanding, clarity, whatever you want to call it, to ease suffering, because none of this had to happen for me with Eddy. I mean, well, obviously it did, because that was his belief and you weren't going to change it. He was infected with this virus in the misinformation world. Please go get a vaccine, wear the good masks,
Wear them properly.
and don't be Eddy. Okay? Thank you, Shannon. We'll be back, and email me your questions. Message me your questions, and thank you for sharing this. Hopefully it helped. Let us know if it did, so we'll keep doing them. Okay? Thanks so much.
Be well.
Be well.